Seizure disorders. Definitions: not a disease. The term seizure disorders is used to describe symptoms of recurrent or chronic brain dysfunction. It's characterized by discrete recurring behavioral manifestations that include disturbances of balance, sensation, behavior, perception, and consciousness. Should not be confused with one-time seizures that result from drug overdose, brain tumors, or other problems. Seizure, an episode of cerebral dysfunction produced by abnormal excessive neuronal discharge, not necessarily a recurring condition. Convulsion, a broad range of behavioral manifestations, including seizure activity. Aura, a specific sensation preceding a seizure lasting from 1 to several seconds and manifested as numbness, tingling, unusual smell perception, peculiar sound perception, feeling of nausea or fear. Status epilepticus. Continuous convulsion lasting longer than 5 minutes may lead to death from heart failure, kidney failure, or both. Constitutes a medical emergency. Incidence and prevalence affects almost 3 million people in the United States. About 200,000 new cases of seizure and epilepsy are diagnosed in the United States each year. Prevalence is highest among children, with occurrence of 5.2 to 7.3 per 1,000 school-age children. About 10% of Americans will have at least one seizure in their lifetime. The etiology is prenatal, maternal infections, fetal growth abnormalities or prematurity, chromosomal disorders, toxicity or damage from drugs or radiation, genetic influences. Perinatal, delivery problems, anoxia. Postnatal, degenerative brain disease, injury, tumors, prolonged high fevers, parasitic infections, toxic agents, including alcohol and drugs. And then unknown. There are types that can be classified by the origin of the seizure, the cause, or the type of seizure activity. Signs and symptoms and clinical manifestations. Generalized tonic-clonic or grand mal. You may experience an aura, loss of consciousness, tonic movements, voluntary muscles experience continuous contractions, clonic movements, intermittent muscular contraction and relaxation, interruption of respiration and dilation of pupils, loss of bladder and bowel control. Seizure activity usually lasts 1 to 3 minutes. Lethargy and disorientation follow the return of consciousness. May occur anytime during the day or only during sleep. The next one is generalized absence or petit mal. Transient loss of consciousness. May have minor motor movements of the eyes, head, or extremities. Last 5 to 30 seconds. Person may not be aware of having had a seizure. The next one is complex partial or psychomotor. May be preceded by an aura, transient clouding of the consciousness, behavioral alterations, purposeless, repetitive, and stereotypical movements or actions. Changes in affect or perception. May become antisocial. Person usually does not remember the incident. The next one is atonic. This type of seizure consists of a brief lapse in the muscle tone, caused by temporary alterations in the brain function. Seizures are brief, usually less than 15 seconds. They originate in childhood and may persist into adulthood. Oral manifestations. So orofacial trauma, lips, tongue, buccal mucosa, teeth, facial bones, or jawbone. Then you have drug-induced gingival enlargement from phenytoin. More marked in the anterior regions and facial surfaces. Does not occur in edentulous areas. Correlated with poor oral hygiene. Characteristically pale, pink, and fibrous. Aesthetic concerns caused by gingival enlargement. Severe gingival enlargement may displace teeth, create malocclusion, and compromise aesthetics. Superimposed inflammation occurs from food retention or mouth breathing, and sometimes it can be alleviated through meticulous oral hygiene, surgery, or pressure appliances.